So here's the Obstetric Anesthesia Emergency Manual, and the idea is to have it readily accessible in the operating rooms as well as the labour and delivery rooms. And it can be hung on the wall from this grommet here, and as you can see, it's very colourful and very visible. So it contains 31 different topics. There's one obstetric life support topic, and then other obstetric anaesthesia emergencies, and 5 other cognitive aids which describe different techniques and procedures. And this is not an exhaustive list. There are lots of other topics which we haven't included, which we will include in the future. But these are the main ones which we thought were of most significance and importance to improve patient outcomes. So how should you use the manual? So there are different ways that you can use the manual. The first way is to actually use it at the time of an emergency. It's difficult for anesthesiologists to actually handle the manual while you're directing the team or actually doing direct clinical care. So the idea is to have somebody in the team who's not actually doing direct clinical care to read aloud as a reader the cognitive aid, to highlight what things are still left undone, which need to be accomplished in whichever crisis you're dealing with. Or it can be used once the crisis has been dealt with and things are stabilised, then to use it retrospectively to check off that you've completed all the necessary steps. The third way is as a teaching tool. So in downtime, anesthesiology attendings or fellows or residents or anybody involved in clinical care or an obstetric patient can read the manual at their leisure and just refresh their memory or learn new things. So the most appropriate place for it to be located is wherever it can be quickly accessed in a crisis situation. In each place where clinical care is carried out, such as in the operating rooms or in the labour and delivery rooms, to have a manual readily available at the patient's bedside so that you can quickly access it. And the idea is to have it visually appealing so people can quickly recognise where it's located. The most ideal place would be hanging on a wall wherever is most appropriate in your facility.